Hi, my name is Abby Rockers. I'm a 7th semester nursing student, and today is April 4th, 2019, and I will be showing how to give insulin through a pen and then also through mixing of regular and intermediate insulin. So I'm going to first start off, I would make sure that I had the proper client. I would go and introduce myself. I would verify the client's name and date of birth, and I'd also verify the insulin order to make sure I had the correct one. I would perform hand hygiene, and then I would place my gloves on here. And I would first start off by I'll show the insulin pen. So what I would do first is roll it 10 to 15 times, just to make sure it's all mixed up properly. Okay, once I had done that, I'm going to scrub the hub with my alcohol pad here. And after that was properly cleaned, I would go ahead and put the needle on. So I will attach the needle onto the hub. And what I'm going to do is I'm going to prime it by using 2 units. So I have 2 units of insulin here. All right. I will then take the cap off, and putting it away from me or anyone else, I would prime the tubing till I heard that click. So then I knew it was properly primed. I would then reprime it to 5 units, which is what I will actually be giving, is the order. And here's 5 units of insulin. Okay. All right, so before leaving the room, I would recap it. The big cap here. Bring it in my patient's room. Like I said, identify name and date of birth to make sure it's the proper patient. I would then pick my site of injection. You can do it behind the arms or the abdomen. Today I'll be doing the abdomen. I'll clean it off with the alcohol pad. Make sure it's good and clean. I'll let it air dry, no fanning or anything like that. Once I felt like it was properly dried, I will take the cap off. I will pinch the skin, 1, 2, 3, little pinch, inject it until I heard that click. And then once I hear the click, I'm going to wait 5 to 10 more seconds to make sure all the medication passes through the pen. Okay, so after I've done that, I will recap. Ooh. Ensure that it is properly on, and then I will unscrew it. And throw it away in the sharps. And then all you have to do is just recap here with the normal cap, and this insulin pen will be ready again to use later on when the patient needs it again. All right, so next what I'll be doing is mixing the insulins. And what I'm going to do is roll the intermediate cloudy one like I did with the first 10 to 15 times. To make sure it has been properly rolled. And then what I'm going to do is I will clean the hub of both of the vials here. So we'll clean this one first. Make sure the hub's properly cleaned. We'll then clean the regular insulin. Okay, so now that those have both been cleaned, I'm going to be giving 8 units of the intermediate acting cloudy insulin, and then I will be giving 4 units of the regular insulin. But to make sure that my needle doesn't get dulled, I'm going to limit the amount of times that I insert it in both of these vials. So I'm going to first inject air into the NPH insulin here. I'm going to get my 8 units. So you can see on here.
Okay.
There. So now that I have that, I'll take the cap off, insert my air, being careful to not bend the needle. Okay, so once that's been injected, I'm going to draw back 4 units of air.
Okay.
All right. I will then inject that into the regular insulin. And then I will just draw up 4 units. So I have my 4 units here.
Sorry, something on the focus.
That's okay.
Okay, there it goes.
Got it? Okay. So then I will inject it into the NPH. And I will be very careful not to inject any extra air. At this point, I cannot inject anything else in. And I will be adding 8 units to make it a total of 12. Okay, so now that I have my 12 units, I'm going to recap. Go. And while I still had this in the vial in the med room, I would make sure to check with a second nurse to make sure that I was getting the right amount of each insulin before I would bring it into my patient's room. So like I said, I'd walk in again, I would verify the client's name and date of birth as well as the order. I would clean the injection site. I went on this side of the abdomen last time, so I'm going to go on the opposite side for this injection. Make sure it was dry. Like I said again, no fanning of it. That is not okay. Wait till it's dry. Okay. And again, I will just pinch. 1, 2, 3, push, inject. Take it back out, and it just goes straight into the sharps this time. No recapping required for that. And I would document all relevant data, and that is it. Thank you.